All people, including workers and renters in Sơn Lôi Commune, Bình Xuyên District, Vĩnh Phúc Province, will be isolated starting February 13, 2020. Vĩnh Phúc People's Council also passed the resolution which would specify the meal allowance for people being medically isolated in treatment facilities and those in isolation facilities. It will also involve permanent and temporary residents in the epidemic areas whose entry and exit are being monitored, and those taking part in checkpoints and quarantine stations at traffic points in the affected area of the province.
Never before has Vĩnh Phúc Province had a resolution that was issued so quickly and so thoroughly, and which pays close attention to the lives and policies of the people in the epidemic area.
All those who belong to the concentrated isolated groups or are being examined and treated in hospitals and medical facilities will be provided with a daily allowance of about $2.5 per person. And for all other groups in Sơn Lôi Commune, Bình Xuyên District, including both local citizens and temporary residents, will be given about $1.7 each.
At the moment, COVID-19 positive patients are being treated and their health is reported to be gradually stabilizing. All localities in the province have set up quick response teams, disinfected crowded places, and provided constant updates to people on the evolution of the disease as well as measures for prevention. With such strong measures from provincial authorities, as well as the solidarity of people and businesses, Vĩnh Phúc is determined to control and fight off the disease.
Anti-soldiers of Regiment 123 wake up at 3 o'clock in the morning to prepare breakfast meals for all quarantined people. More than 1,500 meals are served every day. Ingredients for the soldiers to cook include nearly 100 kilograms of pork, 250 kilograms of vegetables, 300 kilograms of rice and other food such as fish, chicken and eggs.
In the morning, we have a group of soldiers who prepare breakfast for the quarantined people. After breakfast, other soldiers are assigned to prepare lunch meals. Lunches must be served before 11:15 a.m. Although tired, we all feel very happy to serve meals for other people.
With over 400 people returning from China, the soldiers have to work very hard to prepare meals in time. Food is brought to each room so quarantined people don't have to gather in a crowd, preventing the spread of COVID-19.
Everyone is served 3 meals every day. The food here is better than what I was served when working in neighboring countries.
Daily meals served to the quarantined people are the same as those served to the soldiers of Regiment 123. Babies and kids have 3 additional meals, including minced meat porridge.
Playing badminton and kicking shuttlecock are the 2 most favorite recreational activities of most quarantined people here. They are really enjoying leisure activities that they have never had a chance to play before because of their busy working life. Many of them even feel at home in the quarantine zone.
The soldiers treat us very well. They are affectionate and caring. We are served everything we need.
Each room is equipped with a TV and daily newspapers. Everyone has a personal storage locker, a blanket, a mosquito net. They are also provided hot water for bathing.
I feel very grateful for the soldiers. We take care of us with all their heart. We are provided food and basic necessities during 2-week quarantine period. Doctors of military and local general hospital take care of us and give us instructions to keep our health during the quarantine period. Now we know how to protect ourselves to prevent COVID-19 spreading to other people.
For those who felt quite uncomfortable being here in the first place, after a few days getting used to the new life in the quarantine zone, now they feel much better. All the quarantined people are given health checkups twice a day, along with detailed information on how to protect themselves from COVID-19. The soldiers here even clean up the area and gather garbage, while the quarantined people don't have to do this to avoid health risks.